Hi, my name's Courtney and I'm going to discuss basal cell carcinoma. What is basal cell carcinoma? Well, it's the most common skin cancer worldwide. It arises from the basal layer of the skin, and basal cells produce new skin when the old one dies off. So, if these ultraviolet radiation induces the DNA damage, then these new cells are being produced that are abnormal. So there are risk factors to basal cell carcinoma. The first one is the skin types 1 and 2. They are fair skin types that burn easy. There's severe actinic damage with the sun damage, male gender, age greater than 60, patients who are immunosuppressed, patients who have genetic conditionings that increase skin cancer, use of tanning beds, and ultraviolet exposure. So skin types, the Fitzpatrick skin photo classification is used to classify skin for its ability to burn or tan with the challenge of ultraviolet radiation. So as they talked about the first and second types, the first one is white skin always burns, never tans, and white skin for number 2 always burns and minimal tans. With all these skin types, we do recommend sunscreen. So types of basal cell carcinoma, there is an open sore that does not heal. Sometimes it bleeds. There is a red patch or irritated area where you might see some flaking of skin. A shiny or pearly bump or nodule is another one. A small pink growth, or there you could see a scar-like area. So the case study that we will be looking at today is an age 63-year-old male, skin type is 2, has spent a lot of time in Florida's sun as a construction worker, usually burns and then tans. He developed a shiny nodule on his nose a couple of months ago. Not painful, but has increased in size. Past medical history, he just has hypertension. He's on losartan. Family history of no cancer. And his social histories, he lives with his wife. He likes going to the pool, beach, and fishing. And this is a picture of what his nodule looks like. So we want to figure out for treatment, is this benign or malignant? What we would do for that is a shave biopsy to confirm, because by looking at it, we don't know for sure. So we confirm it's a basal cell carcinoma. Our next step would be referring to dermatology so that we can consider the Mohs micrograph surgery, which will keep taking slices of the skin to see if we have gotten all the margins of the cancer. If not a candidate for surgery, we can consider several different creams or radiation therapy. Untreated, the tumor continues to grow through the surrounding tissues. Nodular basal cell carcinomas tend to grow in deep layers. They penetrate the dermis and subcutaneous fat. This leads to formation of large open sores, prone to chronic bleeding and secondary infections. It will destroy the cartilage and bone, causing cosmetic disfigurement and serious functional impairment. It'll destroy nasal passages. Your ears could collapse, vision impairment, and disruption in the tear ducts. So alternative treatments, there are no recommended alternative treatments. You may use supplements to comfort, strengthen immunity, and support your healing. As far as antibiotic and insecticide resistance, these both are not relevant to basal carcinoma treatment. Antibiotics are only used in secondary infections and not part of the primary treatment, as same with insecticides. So how do we prevent and educate our patients? So we're going to check ourselves head to toe at least once monthly. We can see a dermatologist annually. We can see our primary care doctor as well. We're going to want to use sunscreen when exposed to UV lights. We want to UV radiation, not lights. We want to reapply every 20 minutes or when you come out of the water. We want to wear clothes that cover our skin and avoid tanning beds. And this picture here just shows you different ways of checking your skin. So if we had basal cell carcinoma and now we have been treated, we are gonna want to have a follow-up with our dermatologist every 6 to 12 months for at least 2 years. After that, we can follow up with our primary care doctor and perform self-skin checks. And with early diagnosis and proper treatment, basal cell carcinoma is highly treatable. Thank you for your time.